Hello and welcome. Today we are taking a deep and evidence-based look at mint. Not just as a garnish or flavoring, but as a medicinal plant with real biological activity in the human body. I will walk you through its history, chemistry, nutritional value, clinical research, how to use it properly, and when to be cautious. Let us begin. Botanical and historical background. Mint belongs to the genus Mentha in the Lamiaceae family. This is the same plant family as basil, rosemary, and oregano. There are more than 25 species of mint, but the most commonly consumed are peppermint, known scientifically as Mentha times piperita, and spearmint, known as Mentha spicata. Peppermint is actually a natural hybrid of water mint and spearmint. It contains higher levels of menthol, which gives it a stronger cooling effect. Spearmint has less menthol and more carvone, giving it a sweeter taste. Historically, mint has been used in ancient Egyptian, Greek, Roman, Chinese, and Ayurvedic medicine. It was used for digestive problems, bad breath, respiratory symptoms, and as a calming herb. In many cultures, mint tea remains a traditional remedy for stomach discomfort and colds. Bioactive compounds and chemistry. The health effects of mint come from its essential oils and polyphenol. The main active compound in peppermint is menthol. Menthol activates cold-sensitive receptors in the body, producing a cooling sensation. It also relaxes smooth muscles, especially in the gastrointestinal tract. Spearmint contains more carvone and rosmarinic acid. Rosmarinic acid is a strong antioxidant and anti-inflammatory compound. Other important compounds include limonene, pulgone, flavonoids such as luteolin, and phenolic acids. These compounds are volatile, meaning they can evaporate or degrade with heat and long storage. Crushing or chopping fresh mint helps release essential oils, increasing aroma and immediate potency. However, prolonged cooking reduces menthol content because it is heat-sensitive. Drying mint preserves some polyphenol but reduces volatile oils over time. Aged mint extracts may concentrate certain compounds, depending on processing methods. Standardized extracts, especially enteric-coated peppermint oil capsules, are designed to deliver menthol directly to the intestine. Nutritional profile. Fresh mint is low in calories. 1 tablespoon provides only about 1 to 2 calories. It contains small amounts of vitamin A in the form of beta-carotene, vitamin C, and some B vitamins. Mint also provides small amounts of iron, manganese, and folate. It contains antioxidants, especially rosmarinic acid and flavonoids. Because mint is usually consumed in small quantities, its micronutrient contribution is modest. Most of its benefits come from bioactive compounds rather than macronutrients. Evidence-based health effects. Now let us focus on what human clinical research actually supports. Cardiovascular effects. There is limited strong evidence that mint directly lowers blood pressure or cholesterol in healthy adults. However, some small clinical studies suggest spearmint tea may improve lipid profiles and reduce oxidative stress markers. Peppermint oil has mild vasodilatory effects due to menthol, but large human trials showing significant blood pressure reduction are lacking. So we can say mint may support vascular function, but it is not proven to treat hypertension or high cholesterol. Antimicrobial properties. Mint essential oil has shown antibacterial activity against organisms like E. coli and Staphylococcus aureus in laboratory studies. Human evidence is stronger for oral health. Clinical trials show that peppermint-containing mouthwashes reduce oral bacteria and improve bad breath. There is also some evidence that mint oils have antifungal effects against Candida species. However, most antiviral and antibacterial claims come from lab studies, not large human trials. Anti-inflammatory and antioxidant effects. Rosmarinic acid in spearmint has been studied in humans with osteoarthritis. One randomized controlled trial showed that high rosmarinic acid spearmint tea improved pain and physical disability scores compared to placebo. Mint extracts have also been shown to reduce inflammatory markers in some small trials. These findings suggest mint may support inflammatory balance, but it should not replace prescribed anti-inflammatory medications. Potential anti-cancer properties. Most anti-cancer research on mint comes from cell and animal studies. These studies show that menthol and rosmarinic acid may influence cancer cell growth pathways. However, we do not have strong human clinical trials proving mint prevents or treats cancer. Epidemiological evidence is also limited. So this remains a promising but unproven area. Immune modulation and respiratory health. Menthol is well known for relieving symptoms of nasal congestion. Clinical trials show that menthol can improve the subjective feeling of easier breathing, although it does not significantly increase airflow. Peppermint oil inhalation has been studied for cough and upper respiratory symptoms with modest benefit. Spearmint's antioxidant compounds may also support immune balance, but again, this is supportive rather than curative. Blood glucose regulation. Some small human studies suggest spearmint tea may improve insulin sensitivity and reduce androgen levels in women with polycystic ovarian syndrome. Evidence for blood glucose lowering in the general population is limited. Mint may support metabolic health indirectly through its antioxidant effects, but it is not a substitute for diabetes treatment. Digestive system benefits. This is where mint has the strongest human evidence. Enteric-coated peppermint oil capsules are well studied for irritable bowel syndrome. Multiple systematic reviews and meta-analyses show that peppermint oil significantly improves abdominal pain and global IBS symptoms compared to placebo. Menthol relaxes intestinal smooth muscle and reduces spasms. It also helps reduce gas and bloating. For functional dyspepsia, peppermint combined with caraway oil has shown benefit in clinical trials. Optimal consumption practices. For general health, 1 to 2 cups of mint tea daily are commonly used in studies. For IBS, standardized enteric-coated peppermint oil capsules typically provide about 180 to 225 milligrams per capsule, taken 2 to 3 times daily before meals. Fresh mint can be added to salads, smoothies, and yogurt. Crushing the leaves before use releases more active oils. Peppermint oil should not be consumed directly in high amounts. It is highly concentrated. Supplements should be standardized and ideally enteric-coated to reduce heartburn. Pairing mint with healthy fats may enhance absorption of fat-soluble compounds like certain terpenes. Raw mint preserves volatile oils better than long cooking. If adding to hot dishes, add it at the end of cooking. Safety and contraindications. Mint is generally safe when consumed as food. However, peppermint oil can cause heartburn, especially in people with acid reflux. Because menthol relaxes smooth muscle, it may worsen gastroesophageal reflux disease. High doses of peppermint oil may interact with certain medications metabolized by the liver. While mint itself does not strongly affect blood clotting, caution is advised in patients on anticoagulants like warfarin, especially with concentrated extracts. Peppermint oil should be stopped at least 2 weeks before surgery due to potential interactions. Pregnant and breastfeeding women should use mint in food amounts but avoid high-dose essential oil unless advised by a healthcare professional. Supplement quality varies widely. Look for standardized products that list menthol content and are tested for purity. Conclusion. Mint is more than a flavoring herb. It has clinically supported benefits, especially for digestive health and symptom relief in irritable bowel syndrome. It also offers antimicrobial, anti-inflammatory, and mild respiratory support effects. However, it is not a miracle cure. The strongest human evidence supports its role in gut health, while other benefits remain supportive rather than definitive. Used properly, mint can be a simple and effective addition to a healthy lifestyle. If you found this breakdown helpful and evidence-based, please subscribe to the channel, like this video, share it with others, and follow for more science-backed nutrition content.